Scratching the surface. What is the function of the skeletal system? Protection. This is one of the main reasons for the skeletal system because it protects all your main organs. For example, your ribs protect your heart, lungs and liver. These need to be protected because they keep your body healthy, which enables you to do everyday things like running and walking. Movement. Tendons attach muscle to bone and ligaments hold bone to bone. These work together when you are walking, writing. When muscles contract, they pull on your bones to create movement. Without the system that happens, you wouldn't be able to do anything by yourself, which would require help. Support. The spine, pelvis and legs enable people to stand upright. They also create support for your body weight. It also supports all your internal organs in the correct place, which keeps them working correctly. Blood cell production. There are two main types of marrow, red and yellow. Red ensures that there are red blood cells around your body and the correct amount. This is from the red marrow that they are roughly produced at an average rate of approximately 200 million per day. These carry oxygen to your muscles and body tissue. Yellow is a fat cell that can transform into a red bone marrow if you have lost a lot of blood, for example, an open wound. How is the skeletal system divided? This is divided into two parts, the axial and the appendicular skeleton. The axial skeleton consists of 80 bones, 29 bones in the head, 25 bones in the thorax, and 26 in the vertebrae column. The axial protects vital organs. There are 126 bones in the appendicular skeleton, 4 bones in the shoulder girdle, 6 bones in the arm and forehead, 58 bones in the hands, 2 pelvis bones, 8 bones in the legs and 56 bones in your feet. The appendicular skeleton holds and supports the limbs of the human body, which allows you to do everyday things. Different bone types: long bones, short bones, irregular bones, flat and sesame bones. Short bones shows the tarsals and carpals. Irregular shows the vertebrae and sacrum. Sesame shows the patella. Flat bones show the sternum, scapula and the cranial. Long bones: femur, fibia, tibia, humerus, ulna, radius, clavicle, metacarpals, phalanges, metatarsals. Short bones: tarsals and carpals. Irregular bones: vertebrae, mandible, sacrum. Flat bones: cranium, ilium, sternum, ribs, scapula, pubis, ischium. Sesame bones: the patella. Joints. Fixed joints. Your cranium is an example of this joint. Each plate is fixed together by fibrous connection tissue, which does not allow any movement. Slight movable. Your vertebrae is an example of this. Your cartilage and ligaments allow this movement, however, they don't allow too much because it can affect you for the worse. E.g., this can pull on your spinal cord, resulting in it not being able to do things like you did before, like walking. When bending over or putting strain on our back, the spinal disc will release a fluid and become thinner. This also acts as a shock absorber and makes everything easier for you to bend over. Movable synovial joints. The most common joints are hinge and ball and sockets. These allow you to do everyday things like walking and running. The hinge joint is your knee and elbow. These allow you to perform flexion and extension. Your ball and socket joints allow you to do flexion, extension, adduction, abduction, internal and external rotation. This can be found in your shoulder or your hips.